Welcome again to the Medical Terminology Podcast. This episode is Chapter 3, Part 3, Bone Anatomy. In this episode, I'm going to review with you some of the terminology related to basic bone anatomy. In particular, some of these terms are a little difficult to pronounce, so I think it may help you if you can hear them as well as read them. The first term is diaphysis. D-I-A-P-H-Y-S-I-S. Diaphysis. Notice the stress is on the second syllable. It really doesn't sound like it looks. Well, what is a diaphysis? That is the term for the long shaft of a long bone. The next term is epiphysis. E-P-I-P-H-Y-S-I-S. Again, notice the stress is in an odd place, the second syllable, epiphysis. Epiphysis refers to the ends of a long bone. The next term is process, P-R-O-C-E-S-S. A process is a normal projection on the surface of a bone that serves as an attachment point for muscles and tendons. Okay, the next term, and again this one might be a little hard to pronounce, is the periosteum. P-E-R-I-O-S-T-E-U-M. The periosteum is the fibrous outer covering of a bone. Okay, so far we've covered the terms that relate to the outside of the bone, the outer surface. Now we're going to look inward. And the next term is compact bone. C-O-M-P-A-C-T, bone. The compact bone is dense, hard bone that forms the protective outer layer of bones. Now don't confuse that with periosteum. The periosteum is a fibrous outer covering of a bone, and then beneath the periosteum you have the compact bone. The next term is the medullary cavity. Again, that is a hard one to say. Medullary cavity. You've got a strong stress on the first syllable, med, and then you've got a lesser stress on the third syllable, lair. Medullary cavity. Well, what is a medullary cavity? Well, that's located inside the shaft of the long bone, and it is surrounded by the compact bone. And again, the compact bone is the dense, hard bone tissue. Now, inside the medullary cavity is what is called yellow bone marrow. Yellow bone marrow is located within the medullary cavity, and it functions as a fat storage area. Now, another type of bone tissue is the spongy bone. Spongy bone is different from the compact bone. The spongy bone is a lighter bone tissue, and it is commonly found in the ends of the long bones. And finally, inside the spongy bone is the red bone marrow. The red bone marrow creates blood cells. And there's a special term that we have to go along with this. There's a term for creating blood cells, and that term is hemopoietic. H-E-M-O-P-O-I-E-T-I-C. Hemopoietic means it creates blood or creates blood cells. Okay, now we're going to do some practice. What is the term for the fibrous outer covering of a bone? Well, that's the periosteum. 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 Which bone tissue is hemopoietic? Well, that's the red bone marrow. And do you remember what hemopoietic means? Well, that means it creates the blood cells. Okay, next, what is the term for the shaft of a long bone? Well, that's a challenging one to say. It's the diaphysis. 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 Well, what is the term for the bone tissue that is commonly found in the ends of the long bones? Well, that's the spongy bone. Also remember that the spongy bone is where the red bone marrow is located. Now, what is the term for the inner space in the shaft of a long bone? That is the medullary cavity. Medullary. Which bone tissue acts as a fat storage area? That is the yellow bone marrow. And remember, the yellow bone marrow is located where? The yellow bone marrow is located within the medullary cavity. And what is the term for the end of a long bone? That's another one of those hard to say words. The ends of a long bone is the epiphysis. Epiphysis. And what is the term for the dense hard bone tissue that forms the protective outer part or layer of bones? Well, that is the compact bone. And what is the term for a normal protrusion from the surface of a bone that provides a connection point for muscles and tendons? Well, that's a process. Process. Now, those are the basic terms relating to the anatomy of a single bone. Now, the textbook goes on and shows you all the different bones that are in the entire skeleton. And I'm not going to go over those with you. It's up to you to study those and learn them. And I know it seems really daunting, there's a lot of them there. But again, use the divide and conquer technique. Take one part of the skeleton at a time and learn that. Master it, then go on to the next part. I do want to point out in closing, though, that there are a couple of terms in the skeletal system that tend to cause trouble on tests, and it's because of the way the textbook is worded or written. So I want you to watch out for this. On page 67 of our book, it goes into the bones that are located in the arms. And it points out there are two bones that make up the forearm, basically, and that is the radius, radius, and the book describes it as the smaller and shorter bone in the forearm. Well, that's the problem. Looking at the drawings, it's not really clear that it's the smaller and shorter bone in the forearm. If you go by that description, you're probably going to label something wrong on a test. That's not the best way to remember it, so you might even just scratch that out in your book. The better way to remember it is the second sentence, when it says the radius runs up the thumb side of the forearm. When you're looking at any picture, just identify where is the bone that is connecting to the thumb side. The bone connecting to the thumb side is going to be the radius. The other bone that can be confusing is the ulna, U-L-N-A. The textbook says, first of all, that it is the larger and longer bone of the forearm. Well, if you look at the pictures, that doesn't seem to fit either. That's confusing, so you might strike that out in your textbook. The better way to remember the ulna is the next sentence. It says the proximal end of the ulna articulates with the distal end of the humerus to form the elbow joint. Okay, that's med speak, right? What does that mean? Well, it's meaning that proximal is the end of the ulna. That's what closest to the middle of the body, right? Proximal is closest to the middle. Distal is farthest. The proximal end is the end closest to the body. And when it says articulates, it means it joins and moves with the distal end of the humerus. What's that? Well, that's the far end of the humerus, which is the upper arm. So basically what they're saying here is that the ulna connects to the humerus to make the elbow. Looking at it another way, the ulna is on the outside of the arm. It is connecting with the elbow and the pinky side of the hand or the wrist. That's as opposed to radius, which connects with the thumb side of the wrist. Okay, well, that ends this episode of the Medical Terminology Podcast.